Okay, I think we can start. So good morning, good afternoon, everyone, and good morning for some of you. So this is a special edition of AskMeAnything session from our group. We are the Young Medchem from of the French Medchem Society. So just a few words about who we are, and afterwards I let the microphone to Jean. So we are a group of 8 medicinal chemists from industry and academy. We launched this initiative in 2022, in early 2022. Our aim is to help students and young medicinal chemists to get more information about medicinal chemistry. So we have set a couple of initiatives. So we have the AskMeAnything session. So you can see the different episodes in our YouTube channel at SCT at YMCF. We have set up a few mappings, French mapping actually. We have as well a mentoring program with the aim to incorporate master student and first year PhD student. So this is complementary to the EFMC mentoring program. And our last action initiative is the series of videos called My Publication at a Glance. So this is 5-minute highlights of recent publication by the young author himself. And you can find the first episode of this series in our YouTube channel. So you can follow us in our website, of course, in LinkedIn, in Twitter, and you can email us at this address here. So, as I told you, today is a special edition of the AskMeAnything session. So we have Jean Quancard, thank you, Jean, which is Executive Director at Novartis. So this is an industrial topic about finding a job as medicinal chemist, expectation from industry. Just before presenting Jean, I'm going to give you the framework of the session. So please switch on your camera when you ask your questions. Switch off your microphone unless to ask your question to avoid noises. And this session is registered, so this is for diffusion in our YouTube channel. So that's it for our rules. So today this is Jean. So thank you very much, Jean. It's a great pleasure to welcome you today and to have your words and your thoughts about this topic. So Jean started his academic studies by a bachelor degree at the École Nationale Supérieure, and he followed by the master degree in Paris, a PhD degree in Sorbonne University, and a really nice postdoc with Barry Trost in Stanford. And after that, he succeeded to join Novartis in the discovery chemistry department. So he started as a research investigator, and he had more and more responsibility with years, and is now executive director since 2022. Furthermore, he got the award of Young Medicinal Chemist in Industry from EFMC. This is a quite nice award, and he is a leader of the group of best practices in medicinal chemistry. And in parallel, other thing is visiting lecturer in drug design at EPFL at Lausanne, and is author of more than 35 publications and patents. So thank you, Jean, to being here today. And I think this is a great opportunity for young people to hear you today.
Thank you, Nicolas, and hello, everyone. First, thanks to the Young Medchem From team for organizing this. I'm a big fan of the Ask Me Anything format, so I'm very happy to contribute. And of course, it's great to be able to talk to so many young researchers. In industry, we also depend on regularly recruiting people from academic studies to bring fresh ideas. So I'm very happy to be here. I want to spend most of the time answering your questions. I think that's the point. But before I do that, I prepared just a very few high-level thoughts on what are the expectations we may have in industry when we're looking for recruiting medicinal chemists. So I'm going to go through that. So maybe before expectations, it's maybe important to define a little bit a few things. So what are we talking about when we talk about medicinal chemistry? I have to start with this disclaimer. This is the standard one for Novartis, because of course I've been part of many recruiting campaigns, but I haven't aligned every piece of the information in the slides with the company. So medicinal chemists like to think about medchem as an art. It sounds very good. But a little bit to frame the discussion, what is important to understand is that there's two pillars, two big things that we care about in medchem. The first thing is what to make. So which molecules do we want to make towards a drug? And there it's really trying to understand the relationship between the structure of the compound and its properties. For example, what we call ACR, structure-activity relationship, which is the relationship between the structure and the potency of the compounds on the target of interest. And the example on the right, it's a rather old drug. It's the first kinase inhibitor that was ever approved, but it's a nice example because it shows you that in principle in a drug molecule, every atom counts. Right? Every atom almost has a specific purpose. For example, the aromatic rings here and the atoms in orange are important for interactions and affinity of the compounds. The piperazine in yellow is critical for solubility, otherwise this couldn't be an oral drug. And what's really interesting is this very small methyl group in blue. If you don't have that group, the molecule is not selective and wouldn't be a safe drug. So even this small atom has a huge impact on the success of this drug. So really it's about understanding what the purpose of each functional groups, each atom does to your drug molecule. So that's the first part. The second part is how to make the compounds. We have to make them before we can test them, obviously. And that's important for today's discussion because organic synthesis is really at the core of everything we do in medchem. So the second thing I wanted to briefly share is what actually do we do as a medicinal chemist day by day. So I separated into 4 buckets. So the first one is we make compounds, as I said, right? The first step is actually to make the compounds. Very often we do our own bench work. So we work at the bench, especially for the first few years in the company. But also we will help other people, lab associates, we call them lab associates. So these are talented organic chemists who may not have gone through a PhD, and they are more focused at the bench. And one of the roles of the PhD level or higher entry levels in industry is really to help them be successful in their job. And more, we will manage external chemists, so outside the company, in contract research organization in India, China, Europe, US. And there again, we will troubleshoot their reactions and help them be successful in making the molecules. Going to the left, because drugs need to have a lot of properties, we have a lot of data. And so we spend a lot of time analyzing data, potency data, solubility data, et cetera, And we use this data, of course, to decide which molecule to make next to improve the properties. So we design compounds, and we will do that on our own, but also a lot as a team. There's usually more than one medicinal chemist in a medicinal chemistry team. And actually, we also work with many other scientific disciplines. This is on the right. So we'll work with modelers, the computer-aided drug design, CAD. We work with biologists, we work with PK experts, toxicologists, et cetera. And that's actually the beauty of the medicinal chemist, is that because we made the molecule, we actually send it to all these people who will test it, and we get to discuss with all of them their results. So this is a great way actually to get exposed to a lot of science beyond chemistry. And last but not least, of course, as you do in your current role, I'm sure we share our results, we present our results to get input on the progress, on the challenges, we write patents, publications. So with this in mind, this helps me now introduce a little bit what our expectations are when we're looking to recruit. And what I did here is I divided it into first the must-have, so things that you absolutely need to have if you want to get a job. And here I'm going to focus on post-PhD, but I'm happy also to discuss other levels during the discussion. So the first must-have is you need to be an excellent organic chemist. I told you the first step is to make the molecule, and we actually are dependent also on people joining from academia, because you will have worked with the new methods. So it's important that we also get access to your knowledge, to your skills. So we want to know you're an excellent chemist, and we're going to judge that in particular by you having had success or at least impact in several environment and topics. And you see here 2 examples of drug molecules. These can be quite complex, so we need excellent chemists in research. So I tell you my experience. I did a PhD in chemical biology, and at the end of my PhD, I wasn't a very good chemist because I had done a little bit of synthesis, but also a lot of modeling, NMR, biology, cellular work, which was very interesting, but I wasn't a good enough chemist to go into medchem. So I decided to go for a postdoc in really pure synthesis. And at the end of that postdoc, I was a better chemist, and that really was necessary actually for me to get a job. So that's really the core that you need to have. Then there's a lot of soft skills that are important. Mentoring experience, as I said, you're going to work with people in the lab, in or outside the company. So if you have the chance to mentor a bachelor or master students, do it. That can really help. Because we need to look at a lot of data, of course, we want you to have good analytical skills. I come back to that a little bit later. You need to want to work at the bench, because again, at least for the first few years, you will. Some of us actually continue throughout their career because they like it. So if you don't like bench work, that's probably not a career for you. And the last point, these are soft skills that are really important. Drive, you need to be motivated, of course. Curious, because you're going to work on a lot of different projects. And we work as teams, so collaborative spirit is important. And all of these, we're going to try to sort of get an idea of when we interview you. So this is really important, because it's also important for the success you will have as a medicinal chemist. Okay, so these were the must-haves. Then I picked a few which I consider bonus. So these are things that will really help you. Diversity in research experience in terms of areas. So this is a little bit different to 15 years ago. 15 years ago, we wanted people who had done a PhD in methodology and a postdoc in total synthesis, exaggerating a bit, but it was a little bit the profile we were looking for. Now we actually like people with a bit more diverse background, as long as you have an excellent level in synthesis. So if at the end of your PhD, you're already an excellent synthetic chemist, maybe you can, and it's a good idea to do something else for you. Having an experience abroad could also even be a must-have, but it's not strictly a must-have. Definitely at Novartis, the language is English, so that's important. And English is anyway important everywhere now. But also it's about having been exposed to different cultures. Knowledge of medchem can help. Most of us learned on the job, so it's not strictly necessary. But of course, if you have the chance to take a course, that won't hurt. That's probably going to help you. And I finish with what I call the cherry on the cake. This is something that can really differentiate you now from others. Probably in a few years, it's going to be a must-have. And this is everything around computational chemistry. As you know, data science, machine learning, AI is everywhere, and it's really there also in drug discovery. So people who have basic skills in computational chemistry, a little bit of data science, a little bit of modeling. These people really have interesting profiles, because more and more the medicinal chemist, yes, he will make compounds, but he will have to be exposed to these topics as well. We're not asking people to code. We have experts that program, but really at least understanding these concepts, being able to talk to the experts. And why not, you know, if you have the chance in your PhD or postdoc to collaborate with a ComChem group, take a class, that I think will really differentiate you and be attractive for industry. Automation is a little bit also of a topic that we look into, because again, we're trying to automate as much as possible the way we. Okay, so these were kind of the high-level requirements. I just want to spend 2-3 minutes now on the way we run our interview process. Maybe that's interesting for you as well. So typically we will run what we call a 1-hour pre-interview, because we don't invite everyone on site. And there you will meet 2 of us. You will talk about your work for 5 to 10 minutes. We'll ask questions to sort of gauge a little bit your scientific and soft skill competencies, and of course spend time answering your questions, because we also want to convince you that working for us makes a lot of sense. And if we believe that you fit the role, then we will invite you for a non-site interview, and there you will meet a lot of people from different parts of the chemistry department, and you will have a 1-hour slot typically, where you will talk about your research in a seminar with a lot of scientists who will ask you questions. This is a really important part, but I'm sure you get a lot of training for that. Then we have a technical interview where we will try to judge actually your organic synthesis level. So retrosynthesis, reactivity questions. So brush up on your heterocyclic chemistry. We do a lot of that, but of course not only. So it's not only about heterocyclic chemistry. And then we'll have more than one discussion with different people to sort of understand your experience, the way you work, and your soft skills. And there, my advice is to prepare. We see a huge difference between people who have spent time preparing these questions, and it's these questions you can find on the internet. We all use the same, not exactly the same, but I think you can find samples, and it's really worth your time preparing those. And even more worth it to prepare examples to illustrate your answers. So, for example, if we ask you, tell us about a time where you helped a student improve. If you tell us, well, I had 3 students and they all did great, that's not good enough, right? But if you tell us, well, I had a student, he was fantastic, but he had a challenge to organize his days, and I did this and this and this, and at the end he was really efficient, much more efficient, and he delivered. That is going to be very powerful. Right? So use these examples to actually convince us that you have all these skills. At the end of the day, we want to be convinced that you're a great scientist, and we want to be convinced that we want to work with you. So that's the way we judge that. And of course, we want to convince you that you should work for us. So we're very nice, and it's a two-way street, right? You're also kind of interviewing us. So with this, I'm at the end. So I'm going to stop sharing now, and please ask any questions that is on your mind, and I'm happy to answer them.
Thank you very much, Jean. These thoughts are really of interest for each of us, even us, which are already in industry. It's interesting. So thank you for that. It's really nice. And if you have for your question, everybody, please switch on your cam. So don't be shy. Something has to start. Somebody has to start. Sorry. We have Christina.
Hello.
Okay. Hello.
Okay, great. You can hear me. Thank you very much for this. It's very useful. Hello, I'm Christina. I'm about to finish my PhD in medicinal chemistry. And I love what I do. I really love it. I cannot say that I cannot say if I'm an expert in organic synthesis. I do my best. I learn every day and I love it, so I keep searching. So a question that I have is, if we want to proceed in industry but doing research, do we need to do a postdoc before? The first question is this, and the second one, is it possible for a medicinal chemist to become a process chemist?
Okay, these are great questions. Thank you. So the first one is not anymore. A couple of years ago, everybody had a postdoc. Now we've changed a little bit the way we think about this, because we've realized that some researchers are already very skilled and mature after a PhD. So we're open to actually hire people at the PhD level, and we've done that successfully, and they were great hires in the last couple of years. I think the only requirement is that during your PhD, you've probably achieved a lot, more than the usual. And essentially at the end of your PhD, you can demonstrate already that you have the skills that we're looking for in terms of synthesis or other skills, right? So it really depends on how successful you were and how much you've learned. But, it's worth a try. It's definitely worth a try. I know, that for some people, it's also sometimes difficult to go for a postdoc, even for personal reasons. And we've realized that it would be a shame to miss out on fantastic people just because we absolutely want a postdoc. So we've changed our mind on that.
Okay, thank you. Because when I'm checking the profiles of scientists having this type of positions, everyone has a postdoc. And this is why I'm asking.
No, and again, if you had asked me this question 3-4 years ago, I would have said no way without a postdoc, but we've changed our mind.
All right.
On that. But of course, you have to have an exceptional PhD, because you're still going to compete with people who have a postdoc, right? But it's not, it's possible. Now, your second question, is it possible to go from med chem to process chem? Once you're in a company, everything is possible, and definitely, we have fantastic organic chemists that we hire for a medicinal chemistry position, and in the company they maintain their level, or they even increase their level of organic synthesis, and they realize maybe one day that what their passion is organic synthesis, so they move into process chemistry. We also have the opposite. We had a few process chemists who started by doing what we call a sabbatical in medchem. So they started without changing position. They spent 6 months with a medchem lab, and they loved it. We liked them, and so they transitioned. So it is possible, once you have a position in a company, to transition from one role to the other.
All right. Thank you.
Thank you, Christina. So do not forget to switch on your camera, please, for your question. We have Marine, who has a question. Thank you, Marine.
Hello. 3 questions. Why did you choose Novartis, and where did you find the earnings? And did you apply to other things before to choose Novartis family, or no?
Okay, so it's an interesting story. When I was a postdoc in the TROS group, I wanted to go back to Europe. This was a wish for me. And at the time where I was looking, this was a while ago, there were very little positions in France. But luckily for me, I was working with some German and Swiss postdocs who really, what they wanted was to work in Basel for Novartis or Roche. And so they told me about this, and so I applied. I did apply to a couple of things elsewhere, but again, at the time, it was very, very little in Europe. And I was lucky. Actually, Novartis was my first interview. It was successful, and I loved the people that I met there, so I just went. So it was maybe of a special situation. I hope now that there's a little bit more options, but of course, Novartis is still the best place to work.
Thank you.
Thank you, Mary. We have a few people, so Shashank, okay, it's your turn. So you are still mute, Shashank. Okay.
Yeah,
it's
can
your
you hear
turn.
me?
Yes. Could you
Yeah,
switch on your camera,
I'm
please, if you have
looking for
one?
the option and just
Okay, no problem. Let's go.
sorry. Actually,
Thank
I
you.
want to do a screen. Sorry. Yeah, hi.
Hello.
I have a very basic question. So, how did you choose, or when did you decide that you will go to industry and leave academia? I mean, I'm in my final year of PhD, and I'll be finishing in 3-4 months, and it's a bit hard to choose what to do. I mean, so can you?
I mean, it's a tough choice, I have to say.
No.
I mean, so there are two things for me, right? First of all, I was always interested in medicinal chemistry. That's why I studied biology actually initially, in chemistry, and then did some chemical biology, and I always wanted to do medicinal chemistry. And industry is a great place to do medicinal chemistry, although you can still do great medicinal chemistry. Second thing that did the trick for me is at the time where I was looking for a job in France, the French academic system was built in a way that when you start as a early career researcher in academia, you don't start your own group. You actually work for another professor.
Yeah.
And then only many years down the line, you get to have your own group. And that didn't work for me. I thought, if I do an academic career, then I really would like to start my own group.
Yeah.
And it was not possible in France at the time. I know this has changed now, or at least it's changing, which is great. It's different in Switzerland, it's different in the US, it's also different in Germany, I believe. But at the time, yeah, this didn't fit. So that was the second reason not to go for the academic career. Because I thought that, if I go to academia, I want to have total freedom in what I do. If I don't, why not go to industry where I will have more more projects, maybe more funding. So that was the driver for me. But it's very personal, I have to say.
The second question I have is, like, I've been looking for the positions which I'm suitable for. So most of the requirements are fulfilled. Say if they're looking for, I'm doing my PhD in cryo-EM of membrane proteins. So most of the eligibility are like requirements are fulfilled, but then there is a requirement like they need 2 years plus industry experience or something relevant. So how to overcome that? I mean,
so I have to say I don't know so much about the jobs in. So you're saying you're a structural biologist, right?
Yeah, I'm a structural biologist.
Yeah. So again, it probably depends on the company. I know we hired quite a few structural biologists recently. I wasn't aware that they required years of experience. I mean, there are different ways to address this. One is to maybe go in a smaller company first, where usually the requirements are not so high. Again, for medchem it's different, but maybe for structural biology that would be one way. The other way, we have a few postdoc positions in industry, and for specific things, maybe that's one way to overcome this. But my recommendation is if all the big companies, and again, I don't know for structural biology, if all the big companies really want to have experience already in industry, then go in a smaller company first and then make the transition in industry. But again, for medchem, we don't require industry experience when we hire.
And after finishing PhD, what do you suggest? Like, I should take a temporary postdoc and keep looking for a job in industry, or I just keep a separate window, like 6 months or something, and fully focused on applying for jobs?
I think you should go for a postdoc, but not consider it temporary, right? Go for a good postdoc, and if within 6 months you find a job, leave your postdoc. But find a great postdoc and then find a job. I personally, because I mean, first of all, a postdoc can be very enjoyable. I loved my postdoc, even though I worked way too hard. It was a great time, you know, in California with fantastic people, and you can stay for a short time, but if you don't have a job, apply for a great postdoc and then start looking for a job.
Yeah, that's all. Thanks.
Sure.
Okay, thank you, Shashank, for your questions. So this is the time of Dewey. Please switch on your camera, please. Okay,
hello,
that's nice.
Can you hear me?
Good. Yes, that's good.
Hello, my name is Dewey from Sweden. So thank you very much for a nice presentation. So I'm very interested in the seminar today. And so very good to know that the most important skill and expectation from industry for medicinal chemistry job is organic synthesis. And so I have only one question, and it could be very stupid, is that how do we show that we are excellent in organic synthesis? So that you will be attracted and recruit us. Yes, that is my question.
Yeah, great question. So first of all, your CV will show that you have the right skills, right? Because you will have done a successful PhD, maybe a postdoc, showing that, right, through your papers or your research projects, right? So that's, in a way, that's going to get you the interview, right?
But some people did, like some people have PhD and postdoc in methodology or photosynthesis or medchem or chemical biology, so they have many diverse organic synthesis background, and they spend time on different kind of reaction. So how do we show that we are excellent in organic synthesis in general, so that we get into
so the first thing we look at is your experience, right? Your experience will tell us you have, you know, a solid background in organic synthesis. That will get you the interview, and then during the interview you will show that you're a good chemist during your seminar, right? You will talk about your work, and you know, the way you talk about your work and the way you answer questions will already give us an idea of how good of a chemist you are. And then, as I mentioned at the end, we'll have usually maybe 30 minutes, maybe 45 minutes, where we will have what we call a technical interview. So you will talk to two chemists from Novartis, at least that's for us, right? Very, very good chemists. And they will ask you chemistry questions in and outside your work. And so for us, that's a great way actually to know your level in organic synthesis.
So the first step, so look at the background and the CV. So actually what I show is excellent in organic synthesis is throughout the papers or anything else?
Yeah, it's papers, it's who you've worked with, what you've achieved, right?
Yeah. Okay.
So if you have a lot of papers, that's usually a good sign. Sometimes people don't have a lot of papers because they work on very difficult things, but they worked for a famous professor who we know has difficult projects. So that's not necessarily a no-go not to have a lot of papers, right? We try to judge the entirety of the CV, right? But of course we have to, the CV has to show that you're a very good chemist.
Okay, thanks. Thank you.
Okay, so we have Ryan, and afterwards we have Luna and Luxa. So please just wait a bit for your question. Ryan, it's your time. So, okay. That's
Hi,
nice.
Good morning. Good morning. It's the morning here in the US. So my name is Ryan. I am a postdoc here in the US, and I did my PhD in France. And I saw that we have a very similar pathway with Jean, where he did his PhD in France and then went to California for his postdoc. So I had a question regarding, his first position in Novartis was research and as a research investigator. So I was wondering, what was the responsibilities back then for that kind of position, and what helped you in your career pathway in order to get that specific position, and what could help the new postdocs to get this type of position?
So to your first question, right? So this is the entry-level post-PhD postdoc position in research in medicinal chemistry.
Mm.
And typically what happens, at least at the Novartis, is that when you come in, you are part of a project team, so working on a drug discovery target, right? You know, your role will be to design and make compounds. So you will work yourself in the lab, and you will, while you learn the medicinal chemistry and how to design compounds, and you will work in a team where you will have, you know, more senior people that know a little bit more medchem that will, you know, help you learn the job, and you will learn on the job. That's the first part of the role. Then the second part of the role, at least at Novartis, right away when we start, we have we work with lab associates, so people without a PhD who are more focused on the lab. And so we're already a manager, right? So part of your role is to coach, help these people be successful, help them develop. So the same way you would with the master students, if you have ever worked with master students, you really are responsible for the success of the lab associates. So these are the two main roles that we start with. I'm not sure I understood exactly your other question. So what helped me get this first job?
Yeah. So what was the key in your career pathway that helped you in getting that specific position? What would you think was really key?
Yeah. So I think, you know, definitely what helped, what was necessary for me, as I mentioned, is that I did the postdoc that I did, because I wasn't a good chemist after my PhD. And of course, when you go in a group like Trost, you know, if you don't learn chemistry, you know, it's not going to work. So at the end of my postdoc, I was a really good chemist, reasonably good chemist, I should say, not a really good chemist. And that helped me get the interview, and also, you know, pass the technical interviews. I think for me, what probably made the difference is two other things. One is that they kind of liked this, the fact that I did a little bit of chemical biology. It was unusual at the time. So again, I was a good chemist, but I had done something else. I had done biology, I had done modeling. And I think if I remember what they told me really helped is the presentation, the seminar, they liked a lot. I have to say I spent a lot of time preparing. I even rehearsed in front of my postdoc colleagues. So we had a nice setup in the Trost group where people would rehearse in front of the other postdocs, and we would grill each other and give each other's tips on how to present. So if you have the chance to have a couple of people that can help you prepare, I think that helps a lot. Because of course, you know, the way you present yourself tells a lot, you know, about how good a scientist you are, how you can share your science with people, how you can communicate. So this is an extremely important part of the interview. So prepare that very well. And I did also what I told you to do, which is I downloaded all kinds of possible interview questions, and I prepared all of them, you know, a lot. So I had pages and pages of answers ready. And, you know, I could pick one of them whenever a question came.
Thank you.
Thank you. So Luna, it's your turn.
Hello.
Hello.
I thank you very much for your presentation. It was really nice. I had a question. You mentioned international experience, and I was wondering if it was mostly like during postdocs or not, because I'm doing my PhD in France, but I did my master's in the US. And so I was wondering if that counts, or if it's like good to go back, like international.
It definitely counts. You know, it is an international experience that we will appreciate. So it depends a little bit whether you want to do a postdoc, you think you need a postdoc. If you need a postdoc, what is your personal situation? I don't think you strictly need an international experience if you already have one. So if you want to do a postdoc, maybe make your choice depending on what is it exactly that you want to do and what are the best labs that you can do with that.
Okay.
But I mean, so yes, it does count. It does count.
It does count, but it does. Yeah, it doesn't. Yeah, it counts. Even though it's during the masters and not a postdoc. Oh, okay.
Yeah, it counts. I mean, of course, again, I cannot tell you whether you need it or not because I don't know.
Yeah.
Whether at the end of your PhD you need a postdoc. If you do
but if I did a
postdoc
postdoc in France or
I think that's possible. If people have sometimes personal reason to do something, and we respect that. Right? So if you have a personal reason to do a postdoc in France and you already had an experience abroad, makes sense. There's no reason to.
Okay, but it would be better. I don't know.
Again, difficult to answer if I don't know exactly your profile. Let's turn it the other way around, right? If there's nothing stopping you from doing it abroad, why not do it? It can only help you. However, if you have a good reason that not going abroad for your postdoc, makes sense, then that's okay, right? That's more maybe the way to think about it.
Okay, thank you.
Thank you, Luna. So, Luke Sides for you now.
Hello, I am near the end of my PhD. I am mostly cell biology doing these drug tests. And you also mentioned your biology. So I would like to go later to medchem. And the question is then, how hard is it for a biologist to go later to med chemistry? Is it also possible to do some internship or volunteering somewhere to get this experience?
So I had, just to clarify, I had the double training, right? I had the training in biology and in chemistry. I think learning, I don't know how much chemistry you did before.
For bachelor, I had chemistry, but then everything later was mostly biology.
Yeah, so that's probably going to be difficult. However, there's lots of biology in drug discovery, right? So we have many cellular biologists in industry. So, it depends if you're really passionate about chemistry. I don't want to stop you from doing it, but then you will probably have to do quite some chemistry during your postdoc to catch up with the level. Because again, in medicinal chemistry, we really want to have excellent synthetic chemists. On the other hand, there are a lot of jobs in biology in drug discovery. So, if that's your expertise and you like that, drug testing obviously is a very important component of what we do. So it depends a little bit what exactly it is that you want to do. I don't know if I answered your question.
Yeah. Thank you.
Thank you. Now it's for Kusagi. Okay, did we lost him? Okay, so Merveille, it's for you now.
Yeah, thank you. Yeah, my question I think would be also in line with what has been asked previously. So I actually appreciated this opportunity because it was really nice to have exactly the overview of what it is like to be working in industry from different people. And I'm a computational chemist, so I work with medicinal chemists a lot. So my question would be on the other in the other direction. It was interesting that you mentioned that it would be nice for medicinal chemists to have some maybe knowledge in ComChem or CAD or data science as well. But for a computational chemist that is willing to be in very high synergy with medicinal chemists, which kind of advice can you give them to embrace medicinal chemistry and have a bit of knowledge as well, and to be able to communicate well with medchem?
Can I ask? It's a very good question. Are you Are you a PhD postdoc or?
I'm a recent graduate. I actually in a position right now, and yeah, but I graduated last year. Yeah.
Okay, great. So we have actually a couple of computational chemists who became what we call project leaders. I start with this example and then I come back to your question. So the project leader is the person who sort of leads the team of medicinal chemists on a particular project, right? So we usually have 2 or 3 or 4 medicinal chemists. We also have a computational chemist on the team, and the project leader is the one that sort of drives the project, the strategy. And we have more and more examples of computational chemists who are actually so good also at the other side that they also get these roles and are successful in these roles. I think the ones that are successful in these roles you know, really spend the time to understand how you design a drug beyond the computer, meaning, you know, what are the properties of the drug beyond, you know, affinity. So learning all the concepts of medicinal chemistry, pharmacokinetics, physical properties, toxicology, etc. The ones that are really also successful are the ones that sort of adapt their ideas, their computationally generated idea to the reality of synthesis. One of the struggles that sometimes happens between the comp chemist and the medicinal chemist is that the comp chemist has a brilliant idea, but we can't make it, right? So the successful computational chemists are the ones who try to really understand this and take it into account in their designs. But for me, you know, longer term, the sort of the line between the computational chemist and the medicinal chemist will be blurred more and more, right? The computational chemist will learn more and more of the skills of the medicinal chemist and vice versa. And in the end, you know, maybe one is better with a computer and the other one with a flask, but we're going to do the same job. And that's a little bit what I'm trying to say with this message of, you know, expose yourself to the other disciplines of drug discovery. So absolutely great that you're interested in that. Take some medchem classes if you can. Maybe also, you know, try to understand some of the synthesis challenge. We don't ask you to be able to make compounds, but if you know a little bit of organic chemistry, that's going to be extremely.
Great, thank you. I actually have a second question, which is, since you mentioned postdoc, I was wondering, what about industrial postdocs and how to make them successful, and if you can give any advice on this as well.
Yeah, so I think many companies now have postdoc programs, and these programs are great in many ways because, of course, you know, you go in the company, you get exposed to drug discovery already during your postdoc. You get to interact with a lot of people. You have a lot of resources. I think the important thing is that if you do a postdoc in a company, let's say at Novartis, either you get a job at Novartis or you don't, right? Sometimes we hire the postdocs, sometimes we don't. And if you don't get hired in Novartis, you need to have something to show, right? Outside. So it's really important to pick your project, your postdoc project, so that you can publish. We do great science here. We do also, you know, very advanced basic science sometimes that is needed for drug discovery. So some of our postdocs are able to publish great papers, and that's fine. But I think if you do a postdoc on a topic that is going to be difficult to publish and you don't get a job in that company, you're going to have a harder time, right? So this is maybe really important. In the end, there's no right or wrong. It depends on your personal situation. It depends also on what you want to do during your postdoc. There are some fantastic medchem groups in academia where you can also do a postdoc. But for me, the important thing is that if you go to industry, please think that you still will have to publish during your postdoc.
Great, thank you a lot.
Okay, thank you. Christina, your hand is still up. Do you have another question?
Yes, if that's possible.
Okay, good. Okay.
Okay, I have a question. I'm actively applying right now, and I have really difficulty to understand for huge companies like Novartis and Johnson & Johnson and Bayer and things like this. I see my profile in the companies, I see the announcements, and then there is this senior or junior scientist on the title, on the job offer. So I don't know which category I should consider myself after my PhD.
Okay, so that's a tough one because it really depends on the company. Usually let's say the good job advertisement should be clear in what there's the requirements. So typically what we would have, so our entry-level position post PhD postdoc is called Principal Scientist 1, right? And the way we advertise these positions is we say, this is what you're going to do, and you require a PhD and potentially postdoc, but nothing more, right? For more senior position, we would say you require PhD and postdoc plus 5 to 7 years industry experience. And this is what we call the senior principal scientist position. If this is not specified, then it means that their job ad is badly written.
Yes.
And I cannot really help you understand it, because the problem is that, you know, principal scientist at Novartis may mean something different at AstraZeneca. Sometimes they call it senior scientist. For us, senior scientist is usually a position without a PhD, but at other companies, it is a position with a PhD. So I know it's challenging. I'm completely with you. Hopefully, the ads are written in a way that you know exactly what you require. The only thing I would encourage all of you to think about is if a position requires, for example, PhD and postdoc and maybe 5 years of experience, and you only have 3 years, still apply, right? Don't think that if you don't fit exactly the role, then you shouldn't apply, because, you know, sometimes these positions are there to be very generic, and you have an interesting profile, and we will still interview you. But I cannot give you exactly what junior, senior. This is so company dependent. I cannot help you.
I think it depends also on the country. For example, I had an interview for Pharmaron in London, and after a PhD, they consider you a senior. I was surprised. So this is why I'm asking, because I cannot know the categories, and it depends on the country, it depends on the role, it depends on the company, it depends.
Yeah.
Yeah.
But it's not written in the job ad, in the description?
Yeah, there is the job title, senior or junior scientist, but then on the description, sometimes it's not clear because PhD required. Sometimes they mention that maybe you should have a postdoc, but it's not obligatory. So yeah.
So if you don't know and the position is interesting, just apply and you'll find out. That's the way to do it, I think.
Yeah. Thank you.
Thank you, Christina. Kusaji, you have another question.
Hello.
Yes, hello.
Yeah. Am I audible?
Yes, it's okay. You can ask a quick question.
So actually, I have a question regarding whether I have to do postdoc or not, because I was trained as a chemist, like synthetic chemist, in my like early 2 years of PhD, and then I moved to do biology, which is like mostly mammalian cell culture. So means I have a confusion, like, do I have to focus biology skills or chemistry skills when I go to postdoc, or I can directly apply to industry positions?
You were cut off for a bit. I'm not sure I exactly understood your question. Maybe can you? I understood that you did chemistry and then biology, but then you were cut off. So maybe you can repeat.
Yeah. So actually, in my PhD, I did both chemistry and biology work. So means I synthesize molecules and then I check how they are going in the cells and all, their mechanism. So in postdoc, do I have to focus more on synthesis? Because I feel that I have less synthesis skills. So should I focus more on synthesis skills in postdoc to get medicinal chemist position?
I mean, from what you say, you have a very similar PhD than I did, right? So, you know, you made the molecules, now you're testing them. I would, I mean, without knowing all the details, you know, I would really go for, if you're interested in medicinal chemistry and industry, yes, I would go for a postdoc in organic synthesis, because now you've shown in your PhD that you can do many things, which is great. You know biology, you know chemistry, but you need to get this high level of synthesis, and this you can probably only show when you've really, you know, worked on synthesis only for a while. So my recommendation, again, not knowing your whole CV, would be, if you want a job in a big company, to do a synthesis during your postdoc.
Thank you, sir.
Thank you. We have 2 minutes left, so we have time for a last question. Shashank, okay. If anybody else has a question, because Shashank has already asked his question. No, okay.
I think there's one more hand up.
Yes, we have two. So we have 3. So the only people that didn't ask a question yet is Mirjana. So it's your time.
Hi, I hope you can hear me. I'm afraid I cannot turn on my camera because then I will sound like R2D2 because my internet connection is really unstable. First of all, thank you for your presentation. It was really interesting, and thanks to the society for organizing it. So, for example, if you have a candidate who did his PhD in France, postdoc abroad, has experience both doing computational chemistry, organic synthesis, but however, the projects the person worked on are IP sensitive, so there are not that many publications. For example, the postdoc is done on the IP sensitive project and it's going to be a part of the patent. How that person is going to prove on paper, like on CV, that they are really good in chemistry, and since they don't have that many published results, let's say like that?
Yeah, that's a good question. So, you know, we don't only look at your publication record, right? I mean, of course, if you have a lot of publication, that's good, but it's not a strict requirement. And of course, we're fully aware that sometimes you cannot publish. So, you know, if you build your CV in a way that you explain what you've done, right, in your CV, when you put I worked there, you can describe what you did, right, and why you cannot, what you couldn't publish it. If these experiences are meaningful, meaning, you know, in companies that we may have heard of, or groups that we may have heard of, we will still be intrigued. And by the way, I think profiles where you've done synthesis and ComChem, these are not very common. So that's an asset that can compensate for the lack of papers. But don't be scared by the fact that you don't have enough papers. We've hired people who had 1 or 2 papers only because their CV told us there was a reason for that, right? They still needed great science, but they just couldn't publish it. So it's not a no-go not to have a lot of papers. We understand sometimes it's not possible.
Oh, okay. Thank you. Thank you so much for your answer.
Thank you, Mirjana. Jean, do you have a bit of time? Just 2 quick questions.
All right, no problem.
Okay, so Shashank, a quick question, please.
Yeah, hi. Sorry for asking so many things. I'll be quick. Yeah. So this is regarding if I do a postdoc in industry, will it be considered as an industrial experience, or it will be again an academic experience?
Well, I guess industry. Again, it depends a little bit where you do it and what is the topic. If you're absolutely sure that you want to work in industry and you find a great postdoc in industry, you know, why not? Again, the important thing is keep in mind that the topic will need to be publishable. Don't go for a postdoc where, you know, they tell you already at the beginning you're not going to be able to publish everything. That's risky. It's possible, but it's risky. We have exceptions at Novartis. We have a program. So we have 2 programs at Novartis. One where postdocs do basic research and then they publish. We have another program where they work on drug discovery project, but we do it in a way that at the end of their postdoc, they can really tell the story that they've learned medicinal chemistry. So we really help them having a story, even though they haven't been able to publish it. But pay attention to the topic so that you're not blocked if you don't get a job in industry. But it's considered, I guess, an industrial experience.
Yeah, thanks.
Thank you. Okay, Ryan, for last quick question.
Yeah, so I just have a quick question regarding the organic chemistry part. You have been emphasizing it a lot, like it's important to have an organic chemistry background. So the thing is that, for example, in my case, during my PhD, it was an interdisciplinary field when I was doing medicinal chemistry, but I was more focused in the chemistry part, and the biology part was performed by some collaborators. But then I moved to the US to learn more in that biology part, having the hands on the biology, being closer to that biology aspect, learning the computational and all these things that are important for drug discovery. So I was wondering if that would be enough, for example, to apply for this kind of position, or would you suggest me, for example, to apply for another postdoc that is mainly organic chemistry?
No, it depends a little bit, you know, how much chemistry you did during your PhD. And whatever happens, you should apply, right? You don't wait to apply. If you don't get a job, maybe it means that you need to do more chemistry. But I think from what you said, you still did a lot of synthesis. You maybe just did it in an environment where there were also biologists, but that's fine, right?
Yeah.
As long as you're a good chemist and you have some things to show that you're a good chemist, you know, don't wait to apply. If, however, you really struggle to get a job, maybe you can do another postdoc, but I think it's worth it. Worth applying, definitely.
Thank you.
Okay, thank you very much for your questions. Thank you, Jean, for this great and personalized advices. It's really, really interesting. And your global message, I think, is quite clear, definitely. Thank you for being here today. So I think this is the end. So for attendees, do not hesitate to talk about us, about the Young MedChem forum, around you, and do not hesitate to inform around you for this session, which gonna be in YouTube as well.
Thank you, everyone. Thanks
Thank
for all the questions.
Bye.
Bye.
Thank you. Bye.
Thank you.